I'm Cameron Farrokhi. This is my beautiful wife, Stephanie Farrokhi, and we are a family of survivors.
We met about 26 years ago, and we've been married for 25 years. It wasn't long after we got married that before we even got married, that we knew that we wanted a family, and our first son, Kobe, was born about 5 months before we were married. The first time being pregnant, I had no idea what to expect. The pregnancy went well, everything went fine. He was born a healthy young man, and he's now a large 26-year-old healthy man. 3 years after Kobe was born, our family grew again. Our second son, Drake, was born. Pregnancy went fine, everything was very uneventful. We thought we brought home a healthy baby boy, but 5.5 weeks later, we found out that he had a congenital heart defect.
Well, we knew something was wrong. His feet were cold. He didn't eat very well at all. He would fall asleep in the middle of a feeding, after just a couple minutes. He was always scowling, and forehead was wrinkly, like he was in pain, like something was bothering him.
So at Drake's 1-month checkup, his pediatrician noticed that his heart rate was extremely elevated. Blood pressures were low in the legs, high in the arms. She attempted to do an EKG that ended up being inconclusive, and she also did a chest x-ray that was inconclusive, other than a slightly enlarged heart. We were sent to Rapid City to Black Hills Pediatrics and Neonatology for an echocardiogram the next day, and that is when we were told that Drake has the congenital heart defect classified as coarctation of the aorta. We were flown to Omaha the exact same day, and Drake was then diagnosed as failure to thrive, malnourished, and in severe congestive heart failure. And he had his thoracotomy heart surgery the following day.
Well, it was pretty tough, finding out that your 1-month-old needs to have heart surgery to correct a pinching or a narrowing in his aorta. Yeah, it was extremely scary. Luckily, when we arrived there was a great staff. They really jumped into action. He had his surgery the very next day, and within a week we were headed home. We haven't had any complications afterwards for the last 23 years, and he is a strong, healthy young man.
So we were never planning on having any more kids after Drake, just because we never knew if his condition was genetic or not. However, on our 24th wedding anniversary, it was confirmed that I was pregnant again at the age of 44. The first few months of my pregnancy went very well, and then towards the end I contracted COVID, and a few weeks after I had COVID I found out that I had gestational diabetes. And we ended up with Oakley a few months after that.
It was very difficult when Oakley was born. We noticed a lot of similarities between him and Drake. He wasn't eating well. He couldn't finish a feeding without falling asleep. His feet were cold, constantly tired, and we just knew something was not right. So we went to the doctor's office and they ran a bunch of tests. Most of them came back very normal. We didn't really get many answers there. They sent him to Black Hills Peds, where they did some further testing and found out that Oakley had the same condition as Drake, the coarctation of the aorta.
So we were put on a life flight immediately to send Oakley back to Omaha for his heart surgery. And it was just, to have one child with a heart defect was shocking, but to have a second one was absolutely terrifying. So once we got into Omaha, we were met with a large team of doctors and nurses. The room was packed with all of the medical professionals, and it took them quite a while to get him stabilized, where they then ran more of the cardiac testing and did more of the echocardiograms. And it was then confirmed that yes, Oakley did have a coarctation of the aorta, and he was also diagnosed with thickened mitral valve leaflets and a bicuspid aortic valve instead of a tricuspid aortic valve. 2 days after we got to Omaha, he then underwent his first heart surgery, where they did a thoracotomy with an end-to-end anastomosis repair of his aorta.
I felt like the team there in Omaha really did a great job. They worked very diligently and very efficiently to make sure that Oakley was taken in right away, and his surgery went very well. We felt like after the surgery and speaking with the surgeon, we could finally breathe that sigh of relief.
So the day after Oakley's surgery, he was taken off of the ventilator. We thought we could breathe a sigh of relief, but that was short-lived. Oakley ended up developing pneumonia and also a chylothorax, which collapsed his lung. He was placed back on the ventilator, and finally 12 days after all of this started, he was finally able to come home. But that was short-lived again. So we were home for 10 days, and Oakley developed difficulties with breathing. We noticed that he was having some abdominal retractions and also retractions in the throat when he was breathing. We found ourselves on another life flight back to Omaha, and Oakley was then diagnosed with subglottal stenosis due to the prolonged time of being on the ventilator. Subglottal stenosis is a severe narrowing of the airway, and we found ourselves having to send him into another surgery to have that repaired.
So the doctors explained to us that with Oakley's subglottal stenosis, it was like he had ran a marathon for 10 days straight. Finally, after that surgery and after a week of recovery, we were allowed to go home, and it felt good.
Here's Oakley, and he is now 1. He's a very busy, very curious, energetic 1-year-old. He will continue to have cardiology follow-ups the rest of his life. So ideally, the scar tissue in Oakley's heart will continue to grow with him and not have any further restrictions as he goes through his growth spurts. But for now, we listen to what the cardiologist tells us, and we just go in for his routine checkups.
Our best advice to young parents would be to be diligent, be proactive, advocate for your child, because heart disease does not discriminate. It affects all ages.
We are so thankful to the whole team of medical professionals that we have had, that we've been able to work with both of our boys. Their expertise and knowledge has been absolutely wonderful, and the support that you get from in this area from the American Heart Association has been magnificent.